The flu jab is important every year, but very important this year because, as everyone is aware, we've been locked down for the last 2 years. So this year we will all be exposed in a way we haven't been exposed before. So it's really important this year to get that flu vaccine to help prevent us getting very ill with the flu.
The flu vaccine is free if you're pregnant, people who are over the age of 65, Māori or Pasifika people over the age of 55, or people with long-term conditions. If you've previously had a free flu vaccine, you're probably still going to be eligible for one. If you haven't had one before but you have a long-term condition, please contact your practice nurse to find out if you're eligible for a free vaccine. To be eligible for a free flu vaccine as a child, if your child has been to hospital due to a lung problem, a respiratory problem, then they can get a flu vaccine if they're under the age of 5, or if they have a long-term medical condition such as asthma, may mean that they're eligible to have a free flu vaccine. You're still allowed to get one, there's just a small cost. I think that it's a way of protecting those people that might become more sick from the flu. So if you work with children, if you work with elderly, or you just like to protect those around you or yourself, because as we've seen with COVID, even young, fit, healthy people can still sometimes get very sick from the flu.
There is common side effects that we have when getting the flu vaccine, and actually they're pretty similar to those that we had when we had COVID. When you have a vaccine, it stimulates your body to respond to be able to fight off that infection. So actually you get the same symptoms you would get if you were getting sick. But actually you're not getting sick, it's your immune system being primed. You might get a fever, you might get headache, you might get an achy body. That is actually a normal immune response. That is your body telling you there's something wrong, I need to fight it off. And we expect it, but it's nothing like getting the real disease. The flu vaccine is not new. The way it's made, we have lots of data and information. We've been giving the flu vaccine for decades, and we can give it from as young as 6 months old all the way up to over 100.
So every year there are a number of flu viruses in the community, and so the flu vaccine only covers those that were either very common or severe from the previous year. And so every year there will be other viruses that aren't in the flu vaccine that people can still catch and become unwell with. And so it's a prediction game, and so sometimes there will be a strain that is new that isn't covered by the flu vaccine.
So yes, you can actually have your COVID vaccine plus the flu vaccine at the same time. And actually you can, if you haven't had some of your childhood IMS such as the measles, you can also have that at the same time as having your COVID vaccine. So I'd strongly recommend, if you haven't already had all your COVID vaccines or your booster, to please have this at the same time as getting your flu vaccine.